Today, MRI is starting to change again. It is no longer only about a big magnet, radio waves, and a computer. Now artificial intelligence can help MRI create clearer images, finish some scans faster, and give doctors a better picture to study. That sounds very modern, but the real story began much earlier. It began when medicine first learned how to see something hidden inside the body. In 1895, a scientist named Wilhelm Röntgen noticed a strange kind of ray in his lab. He could not see the ray with his eyes, but the ray could pass through skin and show the bones underneath. One of the first famous X-ray pictures showed a hand. The skin almost disappeared. The bones stayed. A ring on the finger looked like it was floating in the dark. For doctors, this was a huge change. Before X-rays, a broken bone could be hard to understand from the outside. A doctor could touch the injured place and make a good guess, but now the doctor could actually see inside. Not perfectly, but enough to change medicine. So what is an X-ray? Think of a flashlight shining through your hand. Your skin and soft parts let more light pass through. Your bones block more of it. An X-ray works a little like that, but with a special kind of invisible energy. It makes a shadow picture of the hard parts inside the body. That is why X-rays are very useful for bones. They can show a fracture, a tooth, or a metal object inside the body. X-rays help doctors find broken bones, bullets, and pieces of metal inside wounded people. That became very important during the First World War. Marie Curie understood this. She knew that if doctors could see where a bullet or piece of shrapnel was, they could treat soldiers faster and more safely. So she helped bring X-ray machines close to the battlefield. These were mobile X-ray units. Think of them like medical vans with special seeing machines inside. They helped wounded soldiers. They saved lives. But there was a problem. At that time, people did not fully understand how dangerous radiation could be. Radiation is energy that can pass through the body. Used carefully, it can help doctors. Used without enough protection, it can harm the people around it. Marie Curie did not plan to give her life for X-rays, but she lived in a time when this invisible power was helping patients before people fully understood the danger. Years of working around radiation are linked to the illness that ended her life. That is one big lesson from the history of medical imaging. Seeing inside the body is powerful, but how we see matters. X-rays were the first big step. Later came CT scans. CT means computed tomography. That sounds complicated, but the idea is simple. A normal X-ray is like one shadow picture. It shows the body from one direction. A CT scan takes many X-ray pictures from different directions. Then a computer puts them together. The result is like slicing a loaf of bread. You do not only see the outside of the loaf, you can look at one slice at a time. CT does something like that for the body. It turns many X-ray shadows into thin body slices. Instead of one flat shadow, doctors can look at one layer at a time. That made it easier to find bleeding, tumors, injuries, and other problems inside the body. Then MRI changed the story again. MRI does not use X-rays to make its pictures. It uses a strong magnet, radio waves, and signals from inside the body. That may sound strange, so think of it this way. Your body is full of water. Water has tiny parts that can react inside a strong magnet. The MRI machine gently changes those tiny parts for a moment. Then it listens as they settle back. Those tiny signals are sent to a computer. The computer turns them into pictures. So MRI is not like taking a normal photo. It is more like listening to the body and turning that sound into an image. If X-ray is like a shadow picture and CT is like looking at body slices, MRI is more like asking the soft parts of the body to send back tiny messages. The machine listens to those messages. Then the computer draws a picture from them. That is why MRI is so useful for soft parts of the body. It can help doctors look at the brain, spine, joints, muscles, heart, and organs. But MRI has a challenge. It takes time. The machine needs enough signal to make a clear picture. The patient also needs to stay still. If the scan is rushed, the picture can look noisy. If the patient moves, the picture can become blurry. If the picture is not good enough, the scan may need to be done again. Anyone who has had an MRI knows this can be difficult. You lie inside a narrow machine. It is loud. You are told not to move. Even a few minutes can feel long. For older patients, this can be even harder. Some people have back pain. Some people have tremors. Some people feel nervous in small spaces. Some people simply cannot stay still for a long time. This is where AI-aided MRI can help. AI-aided MRI means that smart software helps the MRI system and the doctors. It does not mean the computer becomes the doctor. It means the doctor gets a better tool. One important job of AI is image reconstruction. That means building the final picture from the signals the MRI collected. Imagine trying to hear a quiet voice in a noisy room. The useful voice is there, but there is noise around it. AI can help reduce some of that noise so the important signal becomes easier to see. In MRI, this can mean a cleaner image. It can also help make the image sharper. And in some cases, it may help the scan finish faster. Why? Because if the software can make better use of the signals, the machine may not need to collect as much information for as long. Shorter scan time can make a big difference. A shorter scan can be more comfortable. A more comfortable patient may move less. Less movement can mean fewer blurry images. Fewer blurry images can mean fewer repeat scans. For older patients, that matters a lot. It can mean less time lying still, less stress inside the machine, less chance of having to repeat the scan, and possibly a faster path from scan to report. AI-aided MRI can be useful in follow-up exams too. Doctors often need to watch the brain, spine, joints, or heart over time. If scans become faster and clearer, those follow-ups may become easier for patients and medical teams. But there is an important question. If AI makes an image look cleaner, how do we know it is still true? That question matters. A medical image is not a selfie. It is not supposed to be prettier just for looks. It must show the real patient as faithfully as possible. If AI removes noise, it should remove noise only. It should not hide a real problem. If AI sharpens a picture, it should sharpen real detail. It should not invent detail that is not there. That is why these tools must be tested. They must be checked. They must be used by trained doctors and medical teams. The safest idea is simple. AI should help the doctor see. It should not replace the doctor. The story of medical imaging is the story of making the invisible visible. X-rays showed bones. Marie Curie helped bring X-ray machines to wounded soldiers. CT turned flat shadows into body slices. MRI turned tiny signals into pictures of soft tissue. And now, AI-aided MRI may be the next step. It may help medicine see faster. It may help doctors see more clearly, and one day it may help find problems earlier. The invisible is still inside us. Medicine is just getting better at seeing it.